Mommy Track Daddy Whispers podcast is now called Birth Agni Podcast.
Welcome to Mommy Track Daddy Whispers podcast, Season 3.
Also, usually before such a procedure, we really spend time making the parents understand. See, because more than the child crying, which is kind of normal, say if a little child is crying, but then it's the parents who really get worked up, and that is what would probably stress the doctor out. So many things, right? Like in the sense that not every child who maybe even breastfed till the age of 3 gets cavities. So there is something that is individualistically different in each child. So the quality of that particular baby's teeth or the quality of the saliva.
Hello, my name is Divya. I'm your host. I am a certified lactation counselor and a birth educator trainee. And here on the podcast, we bring you educational sessions on pregnancy and the seasonal episodes on women's health and parenting. Today here on the show, we have with us Dr. Pooja Rajagopal, who is a pediatric dentist. And in the part 1 of our conversation today, I ask her how to get a toddler brushing. Why is oral health important? Are there some alternatives to brushing for those difficult days? If you've been following us, if you've been benefiting from the podcast, please go to Spotify or Apple Podcasts and give us a rating. It will help us get found. It will help us reach many more people who also benefit from the podcast, all in public health. And now, without waiting further, let's begin.
Hi, Dr. Pooja. Welcome to the show.
Hey, hi Divya.
So,
I'm
how
so
was your
happy to
day?
be here actually.
Thank you. How was your day?
My day was pretty good. I mean, the usual dealing with kids all day and then coming back home, chilling, dinner, the same old. I mean, there's nothing really new per se that's going on, but yeah, a
All,
regular day at work and yeah.
all right. So, which kid do you remember, if I can ask, which kid do you remember from the clinic today?
Yeah, so the last patient I had is somebody a child who had to extract a tooth for, and typically because we use happy gas or laughing gas while extracting teeth or doing any dental procedure. We have a screen which is on the ceiling and the child is watching, and I've already finished extracting the tooth. The child has no clue about it, and then I asked the child that, so Anaya, shall we go ahead and remove the tooth now? Are you ready? And she's like, yeah, I think I'm good. But the tooth is already in my hand at this point, right? So I'm like, so whose tooth is this then? And then she's like, what? Did you remove it? Like, when did you remove it? So that's like a joke that we kind of play out with most of the kids. And then later they're like, the moment it's done, when the parents come, they'll be like, mujhe to pata bhi nahi chala, I didn't know. So that's what popped into my head.
Yeah, nice. So, that brings me to a survey I read about, dentists
Yeah.
that said that a lot of doctors who attend to children or are going to start a supposedly painful procedure on the child have high levels of stress hormone cortisol in their bodies. So, how has your experience been around children?
Yeah, well, I mean, I would say earlier on in my career, I'm sure it would have definitely stressed me out a lot when you're new to practice and, all of that. I mean, I wouldn't say that even today I ever, walk into the clinic thinking that, I know everything and I'm just gonna, because the moment you become lax, that's when you can go wrong. So I think having a little bit of anxiety, even today, if I'm dealing with a little toddler who's 2 year old, is fine. But I think I wouldn't call it like that it stresses me out that much, because also usually before such a procedure we really spend time making the parents understand. See, because more than the child crying, which is kind of normal, say if a little child is crying, but then it's the parents who really get worked up, and that is what would probably stress the doctor out. So we usually tell them what to expect and what's going to be and how their body language should be, and they should be really positive, and otherwise the child is going to absorb their anxiety. And so once the parents have heard it all out and the child is kind of also told everything that's going to happen, we're not talking about 2-year-olds here, but slightly older kids, then they kind of know what, and we start with a simple procedure, then go on to something where local anesthesia is required. And by this time, I've really understood this child. So I think with experience, that stress level is not as much, but there would be a little bit of anxiety even today, like you said. But I think that's good, right? That's good anxiety, because then it keeps you on your toes and makes sure that you're still giving your best and not getting complacent in your work.
Right. And I read somewhere that most of the general dentists, they still get 4-year-olds up until like 8-year-olds for their for checkup and everything. This entire area of specialized dentistry has come about, I think, I according to me, is very recent, or to me is recent. How do you think the need for a specialized area of dentistry came about? Because from what you just explained is a very individual approach to solving a problem. And it also, like we were discussing right before, it's according to how a child can behave and how does the human psychology when it comes to a kid works. So how did the need for a specialized area of dentistry came about?
I mean, actually, pediatric dentistry has been there for quite some time. Like my mentor has been practicing for maybe 26, 27 years of only treating children. Okay. Like her patients have now become like doctors themselves. So, I mean, it's been around for that long, but yeah, I would say more awareness has happened more recently. However, see, the thing is, with general dentistry, what happens is the clinic is packed. You're dealing with adults, you're dealing with, geriatrics, like older people, and children demand time for sure. It's like most of the kids, like you can't just be like, okay, the child is come on, sit, and I'm just going to pull a tooth out. So that kind of, if you want to give that kind of time to the child to make it a very comfortable experience, you need somebody specialized. Just like there's a pediatrician, when a child, if a child has a fever or something, you will take the child to the pediatrician because that person understands children's needs better. And plus, with pediatric dentistry, it's one step ahead because we need to really understand child psychology, because everything that we do is like literally here, So once I've won the faith of that child, which is because I understand from where the child is coming, once I win the faith, then I can extract a tooth, I can do a root canal, I can do everything. So I think, and then of course, pediatric clinics are also equipped for children. It doesn't look like a clinic. It doesn't look like they've come to a doctor's place. So the moment they enter, half of their, anxiety is gone out. And of course, today's children are kind of pretty demanding. So I think, they'll come and they'll be like, Nini, I want to see this cartoon. After some time, they'll say, no, change this now. I want that one, this one. So, I think a pediatric dentist really caters to that need, gives time, understands the child, and treats their dental needs almost painlessly, I would say, or most of the cases, 100%.
Yeah, that's so. I'm so glad to hear all of that, because it's such a happy place, And also it brings me to the point that to the concept that oral health is more of a lifestyle. So when we want to incorporate that into the general, health awareness of the people. So when you cater to children, when you cater to the parents, do you also make an extra effort to make sure that the family is involved in making lifestyle changes to prevent things that can happen in the future?
Absolutely. I mean, without the family partnering with me, like nothing is going to really happen. Even to get that child to, even if forget the lifestyle thing right now, if they want, like tomorrow, I want to come and get this tooth removed. So if I'm going to explain 1, 2, 3 things to the child today, that when you come next time, this is what is going to happen, this is what you're going to do. So the child is not caught off guard. And if it's a little child, then I don't know how much of it they're going to retain. So I'm going to ask the parents, pay attention to whatever I'm saying. And then when you go home, say the appointment is 2 days later, you're going to keep telling this to the child tomorrow as well, that Dr. Auntie is going to do this, she's going to do this. You have to help her. And when they keep saying that, the moment the child comes the third day, she's like ready, because she knows that, I'm going to do, she or he, that I'm going to do, Dr. Auntie is going to pick up this now, she's going to do this now. So they're so mentally ready that they don't get caught off guard. So definitely the parents play an important role. That's in terms of the procedure. And yes, if they want to prevent this disease in the future, or whatever problem they've come in for, it could be anything, then it is a lifestyle, change that they'll have to make. That could be the diet, and we make effort in understanding what kind of family background that particular child is coming from, or those parents are coming from. Because sometimes we see very little babies who have cavities too, like maybe the youngest I've seen is like 9 months. So about helping the mother with what precautions to take with breastfeeding. Or there are grandparents and uncles and aunts who will be like, it's okay, let them have chocolates and things like that. So even though the mother has understood it, there are so many other factors that are playing role, and just some families who are very sugar driven. Like there's a lot of sugar in their meals and in their, forget it, not like a snack, but even in their actual meals, So we sit and make them understand that dentistry is challenging for a child. We make it fun for them. So that doesn't mean that the child keeps coming back every 6 months with new cavities. We want to make sure that the disease stops completely, and that will only happen if these changes are made. So I literally tell them that, my role is 60%. Like I'm only fixing what is damaged. I can't, do anything about what is going to happen. So if you want to stop the disease in the child's mouth, that's entirely, in your hand. Like I can guide you, but you're driving, like literally.
Yeah.
So
breastfeeding can cause cavity. Is that a case?
not really. So breast milk is not at all cariogenic, or rather doesn't cause decay at all. Also, the manner in which the baby breastfeeds, usually the milk is directly thrown into the throat. So ideally, it's not even supposed to pool. But there are so many other factors, right? So the moment the teeth come in, the baby starts eating. Now, we don't know when the baby starts eating what is being given to the child. Maybe a biscuit has been started, or if the baby is not liking the food, some sugar, jaggery, or honey is being mixed into it. Maybe the parents don't start brushing their teeth, because the baby's teeth, because it's like just 2 teeth are there, 4 teeth are there. So now the food is getting stuck on the teeth, and the breast milk is also going in. And sometimes it's the milk and the food that, the combination of that can lead to decay. However, having said that, so many things, right? Like in the sense that not every child who maybe even breastfed till the age of 3 gets cavities. So there is something that is individualistically different in each child. So the quality of that particular baby's teeth, or the quality of the saliva, how prone to decay that child is, or how many people in that child's family have active decay right now. Maybe the mother has. Not only that, it's like the tongue function, the lip function. So the tongue naturally helps in cleaning the teeth, right? Like that. Now, if the child has something called as a tongue tie, the string of tissue that's there below the tongue. So if the tongue is restricted, the self-cleansing ability is also restricted. So now the milk can kind of pool. And also in the night, sometimes the baby is feeding all through the night, and maybe halfway through the latch is poor now, and the baby has dozed off, the milk will pool. So we usually just advise the parents. I mean, we tell them certain tips and certain discipline that can be followed in the breastfeeding once the teeth have come in. Not that stop breastfeeding because that's going to cause cavities.
Of course. But how many times does one need to brush the teeth of a kid as soon as they get their first tooth? So we know from what you told and from general advice that as soon as the first tooth comes, you need to brush it. And most of us don't. How would you brush just one tooth? But even if somebody starts doing that, is it necessary to brush a child, to brush twice a day? Is that really, really necessary?
Yeah, for sure. Not only because right now there's just one tooth, but also because it's habit forming. So the moment you start doing that at that age, the moment 2 teeth come in and 3 teeth and 4 teeth come in, the baby has by now gotten used to the fact that this is something that's going to happen. This is something I do. It's part of my routine. They resist lesser. And Because, the moment we wait for the child to become a year and a half, the baby knows how to say no. This is something new that you're introducing. You used to never do this in the night. Now, what is this new thing that you're doing?
Yeah.
So simply to get that, to kind of become a part of the baby's routine, it's a good practice. And also because even if it's just one tooth and the baby has started eating, food and debris is still going to collect around that one tooth.
Right.
And you want to especially brush it before going to bed, because you will feed the baby and you don't want, the food in the mouth and the milk pooling in, like we just discussed.
There is a logic behind brushing in the morning and in the night. So there can be toddlers who are really resistant to brushing early in the morning. No, I don't want to do it. I'll do it after breakfast or in the afternoon when I've woken up completely. I'm like in control. So is there a logic behind wanting to brush early and late in the night? I mean, before sleeping?
No, actually, I in fact advise parents that brush after breakfast, because I myself have been doing that for years now. So in fact, if the child has brushed really well before going to bed, then it's absolutely fine to wake up and just, rinse the mouth, wash the face, finish having your first meal. But usually we advise brushing about 15 to 20 minutes after you eat. So that's usually scientifically advised. So once the child is done with breakfast, so 15-20, that's the right practice. So I think that's fine, but not maybe pushing it till afternoon, because then it would be like probably a snack is also done in the middle. So after breakfast, I think is a good middle ground.
Yeah. Okay. And like you said, nutrition is an important factor. So oral health is connected to nutrition, and nutrition in turn is connected to an emotional, and it does have an emotional effect because everything is connected here. It does affect our mood and everything. So I was reading on Wikipedia that this specialized area also works on providing a nutrition specific advice to parents. Is that right?
Yeah. So, we in fact, it's ideally, even when if a mother is expecting, she should be taking care of her. Of course, she takes care of her nutrition, but in terms of oral health, if we're looking at like vitamin D and calcium is something that you want to look at that age, so that at that time, so that the baby's teeth that are forming when the baby is in your womb itself is of good quality, because the milk teeth start forming in the first trimester itself. So that it starts really over there. And then of course, like, for the longest time now, since I myself have, really after that first lockdown debauchery, I have cut down so much sugar out of my own life and processed food, and I really see what a difference it makes to the way I feel. So, and the way your body feels, that I've been telling parents this, that the whole nutrition part for your child, like most of them, they'll be like, really, like now my child can't eat like cake and biscuits because of cavities. This is their age to eat. How do I fight this battle with others? Or people will be like, what's wrong with you? Why are you not giving chocolates to your child? I mean, why are you listening to all this? Is a fad, But the thing is, children today are exposed to a lot more processed food than we were, even probably as we were as kids.
Growing up.
So so I always tell them that do this for the well-being of your child, and the teeth will automatically benefit. Don't do it because he gets cavities. Like, just rule out these things and you'll see, what a difference it makes in his energy levels and how they feel, and better development. And also sugar is super addictive, and most of the stuff that comes out of a packet have sugar in them. Even if it's like Haldiram ka bhujia sale, it will still have sugar.
That's
which is like namkeen,
Yeah, my daughter's favorite.
Yeah, and it's thick. Yeah. So I mean, it doesn't mean that you cut it out, but basically just have moderation in place. On the weekends, we will indulge or whatever that you want to set for your house, but as long as it's not something that the child is really dependent on, and the teeth also get benefited and the body is doing well. So it's a win-win.
Yeah. So what advice would you give to somebody whose child, a toddler, does not want to brush teeth? To prevent decay, to prevent cavities, is there an alternative that can be used? Although no alternative to brushing though, but any other alternative way of making sure that there's no damage or prevent damage per se?
Yeah, but the thing is, nothing that we will do, nothing that I will do in my dental office, I'll give the most beautiful fillings and I will apply fluoride varnish, and I'll do all of that stuff. Nothing is going to work if the brushing is not happening. And we always tell parents that anything that we do, don't think of it like a vaccination, because unfortunately there's no vaccination for cavities. And if that was the case, then we would be out of our jobs, literally. So there is no vaccination, and the point is that unless and until you're going to brush and take care of the diet, don't even bother getting the treatment done, because otherwise the disease is just going to come back. So there's no alternative, but there are things that would assist. So along with brushing and the diet and everything, like fluoride, which I just mentioned, fluoride varnish is usually, it's like a gel that's usually just painted with a brush onto the child's teeth, and it's usually repeated 3 monthly or 6 monthly, depending on how prone to cavities that child is. So that's something that we do over and above brushing and diet, care to prevent cavities. But there is absolutely no replacement for brushing per se.
So what is so I read about brushing, I read about fluorides, like you said. So there was flossing as well. So when I read up on flossing, it was supposed to be a part of our daily lives. But as an adult, I don't do it.
Yeah.
What do you suggest? And why is it important?
So definitely, like, flossing is something that, I mean, if I pick out any children's dental guideline or dental guidelines in general, it'll always say that you have to floss every day. The same with children. I mean, and because we see children who come in with 2, 3, 4, 5, maybe 10 cavities, we usually we teach the parent how to do it. But I know, like, most of them have that look on their face that it's a task for me to get the child to brush their teeth twice. But some of them do really want to go that extra step, so we tell them that at least try to do it in the night, and we teach them how to floss. So again, it's risk based, right? So now I, for example, have never had a cavity so far, touch wood. So even then, like, that box of floss is always there in my washroom, and maybe not every night, but maybe every other night when I feel I can't spend that extra minute, I'll floss my teeth. But I know I'm not prone to cavities. So if the child does not really have cavities, I'll tell the parents it's fine. Like, if it's a child who's cavity free, but if it is a child who is prone to decay, and if you really want to go that extra mile, that my child is not going to undergo dental treatment ever again, then you may want to spend that extra 2 minutes in flossing. And now you also get floss with that handle, which is really, really easy to use, other than the spool, the thread that you had to, that's almost impossible to do it in the child's mouth. But with the handle, the floss with the handle is amazing. I mean, once we teach it to you, and a couple of times, and a lot of parents are able to do it pretty regularly.
And it also said, the American Academy of Pediatrics said that you should visit a pediatric dentist when the first tooth come in. So because all these things are not very generally told to you when you go to your general pediatric, like flossing and all these things as a part of your lifestyle change. Another question that comes to my mind is, apart from preventing decay, cavities, why else does one need to take care of their oral health? How does it affect the body?
So, actually, even when I put out, tell somebody, or if I put out an awareness post saying that, you need to come in and you need to see a pediatric dentist the moment your child has one tooth, typically it's like, why am I worried about my child's dental health? The child has like one tooth, firstly. And secondly, I have practically never been to the dentist. I mean, the parent might say that, or I've been to a dentist like now. So the thing is, like, dentistry and pediatric dentistry is not just about the teeth. It's when I say oral health, there are a lot of things. So like we were just discussing about the tongue function, the lip function, and children who have who later end up getting braces because they have crooked teeth, or the way the jaw development is not optimal. So when we see children very young, we usually see a lot of things other than just the teeth. So we even evaluate the way they breathe. So when we give happy gas to the children, we are even able to figure out whether this child is actually able to breathe through the nose really well, or the child is a mouth breather. The children who breathe through the mouth have a lot of other issues, because it doesn't help in good orofacial development if you breathe through the mouth. Children, so that usually when we see somebody who mouth breathes, we ask the parents further history about, does the child snore, does the child bed wet, is the child hyperactive, or do you think the child is not sleeping well? So many things like that. And all of this would be related to the fact that the child may be snoring and is not able to really breathe well through the nose. So there are so many factors behind it. So we evaluate the overall perspective, just even as simple as looking at the posture of the child. So even simply looking at the posture can tell us that, okay, this child is probably a mouth breather. His mouth is always open. His head is drooping a little bit. It's giving me something, some clue about the well-being of that child and not just the teeth. So all of this is evaluated, the airway. So when we see the child really young, and like when maybe one or two teeth are out, we tell the parents not just about, okay, yes, brushing and diet is one important aspect of it, but also why breastfeeding is important, and why they should not get hooked onto a bottle, and say for example thumb sucking, or so many things, or if we see the tongue function is not adequate. So all this contributes to the overall well-being of the child. So it's that as well. And coming to oral health and the well-being, if you're looking at the teeth, the moment there are cavities in the mouth or the teeth are not doing well, it is going to affect nutrition, because now this child is not able to eat like textured food, fibrous food, or hard stuff. The child starts adapting, stops chewing from this side, starts chewing from only one side, or only prefers soft, pureed food, or very soft. Some parents will say, my child is just not able to eat, and the child opens the mouth, there are like 5 cavities. So that is again contributing to affecting the health of the child, you can say. Right. So it's all interrelated, really. Can't really say that, oral health is okay, like I have some 5-6 cavities, it's fine, the rest of me is fine.
Yeah. Actually, we do somewhere down the line, probably because of the way it's advertised and everything, we do look at oral health as a beauty factor, the way I think toothbrushes and toothpastes are advertised in the market. I think that's why we mostly associate, beauty with.
I think one of the biggest enemies of, I mean, I don't know what's the right word for it, or I don't know, the biggest factor that plays a role in why people don't want to go to a dentist is because of the fear, the way it is projected, right? In every movie, anything you look at, dentists are always like super scary, and they have these scary looking tools, and it is going to hurt. And in fact, that is one of the biggest battles that we have every day, right? Because the parents, when they come in, most of them are so anxious because they're thinking of their own experience, or somebody would have told them that I got a tooth removed and it was extremely painful. So they usually, even if they see a cavity, they're going to keep delaying it because they're going to be like, my child is not going to be able to cope. So they'll wait and wait till it gets worse. And so I think that is one of the biggest, another big reason why it's ignored.
Yeah, I was about to ask you, what is that biggest challenge that you face as a dentist, and more so as a pediatric dentist? I think you've covered that for me. Another question that comes to my mind is just maybe trying to bust some myths, or get more information on newborns. So when a baby is born, do they come with teeth? Because we usually think, the tooth will come after this age, these many months. So do they really have teeth?
Yeah, so it's doesn't happen very commonly, but it does. They're called natal teeth, and we've dealt with a bunch of them in my practice, where we've had to remove natal teeth for babies who are just like 10 days old, 15 days old. So yes, it does happen sometimes. It's like an aberration, like it's nothing to be worried about. If the teeth are doing okay and there's no problem, the baby's doing fine, we don't even extract them. But sometimes the teeth are not formed really well, so they're really loose. And there is risk that the child may aspirate, the baby may aspirate and will get stuck in the windpipe. So if it's very, very loose, then we think of extracting it. Or if the mother's having, severe difficulty in feeding, or if the baby's tongue is getting hurt because the baby suckles, right? And then and if the natal teeth are sharp or something like that, those situations we may extract it. But it does happen that there are babies who are born with teeth, or sometimes the teeth show up right, like the baby is born and in a few days the teeth show up. Then it's called neonatal teeth. So they're dealt in the same way based on whether it's harming the child or it's causing any difficulty. If it's functionally, if it's doing okay, then we just let them be.
Okay. And what is the relationship between, you referred to bottle feeding? What is the relationship between bottle feeding and the effect it has on someone's, on a kid's, on a rather a baby's tooth or development?
Yeah, right. So it's not the teeth per se, but it's the jaw and the muscles around. So the thing is, like this, the way the baby breastfeeds and the way the baby feeds from a bottle is different. So the way the baby breastfeeds is like we say it's like natural exercising and physiotherapy of the mouth of the baby. The moment the baby breastfeeds well, the baby learns a lot of stuff like how to position the tongue. Gradually as the baby grows, the baby learns to swallow correctly. The breathing is more healthy. Whereas when the baby feeds from a bottle, the tongue posture is not the way the baby would normally do when the baby breastfeeds. The tongue is lower. So what happens is when the baby drinks from bottle, the cheeks work more, like because of the suction that they have to create, and the tongue is below. So if the cheek is too strong and the tongue is not working, the jaw is not growing well because the cheek is putting too much pressure on the jaw. So the jaw tends to become narrow. The jaw doesn't grow to its full potential. This is again if there's extensive bottle feeding. Although we do advise the parents that if you're okay, if you're able to manage without introducing a bottle, nothing like it. And if at all you'd have introduced a bottle already, working mothers due to express milk and things like that, and you just don't want the baby getting hooked onto it completely. So maybe like at meal times, the baby can have express breast milk from a bottle, and probably best to wean by the time the baby is 1. The bottle should have been completely weaned. That's the ideal practice, because if it continues after, it becomes more harder to wean, and B, it will cause dysfunction in this area. So many babies then end up mouth breathing because the tongue position is not correct. The mouth may be open. Plus, bottle feeding tends to pool the milk heavily because the baby doesn't have to work at expressing. The milk just flows out. And the bottle is there. The baby's in the crib. Maybe the mom is busy and the baby is taking hours on sipping a little, sleeping a little, sipping a little. The milk is pooling and it will tend to cause cavities. So it's a lot of, it's not just cavities in teeth, but the overall development of this area is also dependent on it.
But that's a handful of information, and it's very important that we get to know that aspect of oral health, that it's related to your tongue, cheek, the overall function of the mouth, and not just teeth.
the face actually, because also your upper jaw is connected to your airway, right? Like the roof of your mouth is the base of your nose, right? So the moment if your upper jaw doesn't develop well, then your airway is also constricted, which means the child is not able to breathe adequately from the nose. And yoga and all these guys keep talking about that breathing, like you have good breathing takes care of so many issues, So if the baby can't breathe well and is compensating that by opening the mouth and breathing from the mouth, then it's going to cause a cascade of other issues. Yeah.
And I had this question on my mind because when we talked first, we talked about how fathers get involved, and I think I asked you that question when we talked the first time. Do fathers also come to you with children, or is it just the mothers? Because nutrition is more in the house, and sometimes for some mothers, the fathers are not at home and all of that. So I wanted to ask you that question. Do you see that kind of an involvement when it comes to nutrition from fathers as well?
Yeah, it's mixed really. I mean, I do see, there are fathers. I mean, in fact, I do see families where, the fathers say, I myself make my child brush and, I'm the one who takes care of this part. So there are those absolute hands-on fathers who are just there listening to everything. And then they'll be like, and then, the mom and the dad will start looking at each other and like, yeah, you're the one who brings that, or you're the one who brings this. And they're actually having an active discussion as to, we need to make these certain changes. And of course, then we also see, sometimes where both parents are present. And then when I start talking about diet, maybe the father wants to walk off and be like, oh, you know what, like mom's going to look after this. So we see all kinds really. But I mean, of course, all fathers are involved in the well-being of their child, and they want things to, or when it comes to the technical stuff, like when I'm going to say, okay, this is the tooth and this, and what, and they want to discuss the financial part of it, then the mother's going to be like, 1 second, I'll just call my husband and this part you explain it to him. So it kind of
It balances
that's
out
how it
that.
works.
Yeah, yeah. All right. And touching upon, I also read that pediatric dentistry, the significance of or their involvement with special needs children.
Hmm.
Is there a special approach to when you study, when when you practice? Is there a special approach to children with special needs?
Yeah, of course. Like we had a whole, we would always have a separate chapter on that and understanding the commonly seen, conditions or disabilities that we may deal with. So yes, of course, we all know that behavioral issues are like majorly on the rise, and though I mean we are not in the position to really diagnose. So sometimes the parents itself come in saying that my child is a borderline autism, or he's been diagnosed with attention deficit hyperactivity disorder, and then there are children where when I talk to the child and when I start, interacting, I can see that there are some red flags, in terms, because we routinely see 4-year-olds and 5-year-olds.
Yeah.
I'm usually pretty well versed with what's the milestone that I'm usually expecting at that point, or a child who's just not able to pay attention to me, things like that,
Yeah.
not able to sit still and stuff like that. So yes, we do read up and understand these things, and if it's undiagnosed, where when you ask the parent, they'll say no, it's fine, huh? He's a little hyperactive, he can't sit for his online class, but then it's normal and it's okay, children are like that. So we try to point out to them that maybe I'm seeing something, I may be wrong, and I'm not in a position to diagnose it, but we guide them that you could get an opinion from somebody like a specialist, a developmental pediatrician, an occupational therapist, or a pediatrician to begin with, and no harm in looking at it, and we tell them, and sometimes, then the parents do feel sometimes a little overwhelmed, like, really, like, I need to go to a developmental pediatrician? What are you saying? People are going to be, what do people think or people say? And like, why do you care about people? If we feel that there may be some concern, the best case scenario is that you'll go there and the doctor is going to say it's absolutely fine. And even if they do detect, they're going to help you and it's going to help the child get better. So we do deal with all these different situations, or children who may be, having a history of epilepsy, or we've even dealt with cerebral palsy and things like that. But more often than not, we see we see more children with that aspect of it. The behavioral issues is what we deal with more commonly.
Yeah, and that, just to assume, and you're to correct me, that is also because you get to spend that amount of time with the child, being a pediatric dentist. Oh.
Yes. And we've also read about more about, like, so there are different techniques in handling these kids, right? Like, so we know what is specific to autism or what is specific to this particular situation, that, like, I have to give an early morning appointment, or the child needs one, two, three appointments simply to get used to that environment. Say, for example, an autistic child may want to get used to the environment, feel everything, and then by the fourth appointment, he or she gets comfortable. So there are particular traits, unless you don't know what is specific to that disability or that special need, how will you be able to handle that child?
All right.
So that's what works. And of course, time, with children who have special needs, you're going to have to give them that amount of time to accommodate and settle in.
And that's a part of the practice. That's a part of general practice.
Yeah.
All right.
Yeah. However, having said that, like we talked earlier about general dentists and pediatric dentists, I wanted to mention that even now there are many, many cities in India that probably don't have a pediatric dentist, or a parent would really have to, if they have to take their child to a pediatric dentist, would have to travel a lot. So there are many, so we can't probably reach every child who is in need, So there are a lot of general dentists, though, who genuinely love treating children. And though they may not have undergone a master's, there are many, like, short programs that they would have learned and try to learn about children's child psychology, the treatment techniques, and they have really gotten good at it. So it doesn't mean that, so you are, or that particular parent is in a place where there is no pediatric dentist around, what are they going to do, right? So they can look around and find a general dentist who does give that amount of time and has some expertise and has some training in treating children, and definitely go to them.
That was it. We will continue the conversation and discuss tooth decays, cavities, etc. in the second part of our conversation that will release next month. If you do not know already, we alternate between the pregnancy series, the educational resource, and the seasonal episodes, both of which are released bi-weekly. Next up, we chat with the doula as a part of our Doula Stories conversation that comes after part 2 of this conversation. And till then, you enjoy, take care. If you have something that you want to share with me, if there's a particular episode you want me to do, please send me a note, send me an email, DM me on Insta, and we'll try and get it as soon as possible. Till then, stay tuned.